blessed good afternoon to one and all. I greet you all in the wonderful name of our Lord and Savior Jesus Christ. This is the St.Charles Church of God Health and Wellness Program. And this evening we are glad to have with us Dr. Ruel Mahadeo. Our topic today will be understanding kidney disease awareness and prevention, especially in Trinidad and Tobago and beyond. So again, a pleasant good evening to one and all. And again, we welcome you to this program. We thank God for the opportunity to share on this special edition as we focus on health issues. And so the issue at hand is a very, very serious issue that affects many families in Trinidad and Tobago, kidney disease. And so I said we are honored to be here and to have with us Dr. Ruel Mahadeo to help us to understand the cause, to look at the warning signs and prevention and treatment options that are available to us. So welcome, and God bless you.
Thanks.
Please feel free to share a little bit about yourself before we get into the meat of the matter today.
Okay. Well, I'm Dr. Mahadeo, as Pastor introduced me there. I'm the owner and operator of the Manarby Medical Clinic. And to see we have filming going on today. So I've been a medical doctor for about 7 to 8 years now, with an interest in emergency medicine. I still work in the Southwest Regional Health Authority, and in my spare time I run the Manarby Clinic.
Yeah. Okay, could you care to elaborate a little bit about what services are offered here at your center?
So at the clinic here we offer a range of tests. We have our lab investigations, anything from a complete blood count all the way to cancer screening. We offer X-ray services, we offer ultrasound services, and general checkups, as well as some specialty services, including some cardiology, some psychiatry as well. So feel free to reach out to us, if you guys have any questions, or if you just want to pop in for a visit.
Yeah. Well, thank you so much, Dr. Mahadeo. And I might act interchangeable because we are very proud to have you as a part of our congregation at St. Charles. So I might call you brother along the way, if that's okay.
That's
all right. So let's begin. And we want to talk a little bit about what is kidney disease. Dr. Mahadeo, many people hear the term kidney disease, but may not fully understand what it is. So could you share with us what exactly do our kidneys do and what happens when they fail?
Okay. So what our kidneys are essentially two organs located in the lower abdomen of our body, or pelvis, more towards our back region. So our kidneys are shaped like kidney beans that most of us are familiar with, and they are roughly the size of our fists, or clenched fists, right? So our kidneys, they function to filter our blood. They're primarily the filters of our blood. They remove toxins, they remove excessive fluids, right? They essentially act as a strainer of our body, right? So those are just some of the roles of the kidney. As when you go into depth, they actually provide a lot more service to the body in terms of managing our electrolytes. So those are the salts in the body. They work to help us regulate our blood pressure. They also work to, keep our blood count or hemoglobin in check, right? So those are just some of the brief things that, our kidneys do for us.
A wide range of function.
A wide range of function.
Yeah, so what happens when our kidney fails?
So our kidney being the main filter of our body, removing these toxins, when the kidneys start to fail, right, that filtration function decreases. So we have an accumulation of toxins in the body, a lot of waste products, right, and those toxins tend to affect other organs of the body, right, and essentially leads to a total shutdown of the body, and
We've often heard the term in terms of when we have an ailment in the kidney, CKD.
CKD.
Yeah, you want to elaborate a bit on that?
So CKD stands for chronic kidney disease. So chronic kidney disease is defined as persistent kidney damage or dysfunction for a period of 3 or more months, right? If you do have damage to the kidneys and it occurs for a period of less than 3 months, we refer to it as acute kidney injury, right? So acute meaning something of a shorter duration.
Right. And then we go to my follow-up question. What then would you describe as kidney failure?
Okay. So to describe kidney failure, we need to go a little bit more in depth into how the kidneys work. So as I described, the kidneys are these two organs towards the lower abdomen and the pelvis, right? So these kidneys, they are made up of millions of small units that we call nephrons. And these are what we refer to as the strainers of the kidney. So these nephrons contain a clump of interconnected capillaries called a glomerulus. So these are where the blood is filtered and the waste products are removed. So in a normally functioning kidney, right, we calculate the filtering ability of the kidney based on blood test called the creatinine, right? We also help determine the rate of kidney function based on the age and the sex as well, right? So without going too much into depth with it, normal functioning kidney is supposed to remove about 90 mils of urine from your body every minute. So kidney failure is when the body removes less than 15 mils a minute. It's a bit complicated. Right.
Yeah. So it actually affects, as you said, the removal of toxin from your body. So that's if that's not happening, the kidney we can refer to it as being failed.
It progresses to the point of end stage.
Okay, good. So doctor, being such an important, organ in our body, can kidney disease develop silently without us really having a clue?
Yeah, so kidney disease is something known to develop silently in a lot of persons, especially with coexisting medical problems, mainly diabetes and hypertension being the two big chronic diseases in our population that lead to kidney failure.
Right.
So in a lot of cases, when it goes unchecked, kidney disease is actually picked up on an advanced stage when it is detected. It would be around stage 3.
And so in fact, Doc, you're actually suggesting that we really, unless we are sensitive, by the time it is known, it's almost,
it's already well developed.
Okay, good. Well, like I started by saying, we hear it all around. Tell us though, how serious is kidney disease in Trinidad and Tobago?
So in our population in Trinidad and Tobago, we actually have one of the highest rates of chronic kidney disease in the region, in the Caribbean. It's mainly to do with our diet here in the Caribbean. So we have a melted pot of cultures here, and all of us love food. We love our salt, we love our spice, we love our sweet foods. So it has a lot to do with diet.
Right. Well, actually, not only is kidney disease, very high in terms of the region, but even the stats will show we are on the higher end per capita, even worldwide. And it is said about 200 or 300 patients every year enter, for dialysis, and that's the last stage of, the kidney disease. So we in fact do have a very serious problem in Trinidad and Tobago and beyond.
Yes, we do.
Sad to say that the figures also show that roughly 38 or 40% who reach the stage of dialysis actually lose their life to this disease. So it is a very, indeed a very serious situation in the Caribbean, in Trinidad and Tobago.
Yes.
And even financially, it cost the government of Trinidad and Tobago, I think the last figures we have was $135 million per annum to deal with it. Yeah. So you touched on it a little bit, Dr. Ruel, but why is kidney disease, why is the rate so high in this country?
So, as I mentioned, it has a lot to do with our diet in the Caribbean. We eat a lot of fast foods, a lot of processed foods, rather than the healthier alternatives that are available. So diet is the number one factor, as well as the rising rates of obesity, especially amongst the young persons in the country. All of these are directly leading to a rise in chronic kidney disease levels.
And Dr. Ruel, I'm glad you raised that last point about the young people. Are young people now being more affected by kidney disease? And even in your short time, are you seeing more and more younger people being affected? And you mentioned the lifestyle, especially diet and the fast food craze and so on. Have we seen that? Does the figures show that?
Yeah, so more now than ever, actually, we have been seeing a lot of young persons being diagnosed with chronic kidney disease in a younger age bracket than previous years. It has a direct impact on the youths nowadays.
Well, we want to look a little bit as to some of the main causes. I know you mentioned, high blood pressure and diabetes. What are some of the main causes other than that, that one can have this dreaded failure of their kidneys? What are some of the main causes other than, I know those are the two prevailing factors, but are there other things that we tell of that?
So some of the other factors that, we can't control and we can't address are things like alcohol use, right? Smoking, right? As well as, certain medications such as NSAIDs, right?
Okay.
NSAIDs being drugs like ibuprofen, diclofenac, Olfen, those are NSAIDs.
Which is over-the-counter painkillers.
Over-the-counter painkillers. So, persons who take a lot of these medication, aches and pains on a regular basis, may silently be developing kidney disease and not even know. And of course, we have some factors that, we have no control over, such as a positive family history, right, of kidney disease. So a person with a positive family history of kidney disease, they are actually 3 times more likely to develop kidney disease than someone who has no positive family history.
Oh, that's amazing. And it's a fact that many of us are not aware of, so sometimes when we have these indicators, as you mentioned, if you've had it in your family, you need to really pay close attention. Okay. So tell me, Dr. Ruel, what symptoms should we never ignore, in relation to kidney disease?
Okay. So, as I mentioned earlier, we only see symptoms of kidney disease when it's a little more advanced, right? So when we reach that stage 3, stage 4, and usually some of the first symptoms may develop. Sometimes in the morning you pass urine there and you realize the urine looking a bit foamy, or a bit foamier than usual, right? To the point where you flush the toilet and you realize the foam is still there and it lingers. So this foaminess of the urine could indicate that you're actually leaking protein into the urine, which is something that should never happen at any time once you have a normally functioning kidney. Another symptom could be swelling in the body. Most commonly, it's swelling to the lower limbs, to the ankles, all the way up to the shin, right? You may have some swelling to the face, around the eyes. So those are usually some of the earlier signs of kidney disease.
Tell me a bit about frequent urine.
So frequency of urination, it could be a sign of underlying kidney issue as well. or it could also be indicative of something like diabetes, which again is something very prevalent in our population. So if you do find that you're passing urine a bit more frequently than usual, right, probably come in and we'll have that checked for you.
Okay. I know we promised that we will talk a little bit more prevention and treatment and so on. So we'll get to tests that might be available. I know some might be very simple that, we can come just walk in and have these tests done.
Yes.
But I want to ask you, Doctor, kidney disease affects the entire family, doesn't it? Emotionally and financially. What have you observed about patients and caregivers?
So kidney disease has a toll on the entire family, right? Both an emotional toll, a financial toll. So often patients, especially patients with end-stage kidney disease that depend on dialysis, right? These patients, they have to be dialyzed 3 times a week. And often dialysis sessions take 3 to 5 hours, right? So these are a lot of time spent in these centers. And these patients, they need caregivers, right? To carry them to their sessions, to make sure they're well taken care of at home, they have their meals, they have their medications. So that carries a lot of burden on the caretaker, It could present as emotional issues. They could develop a bit of depression because, they're stuck with this rule of caring for this person as much as they love them, It's still a bit of a burden. They may miss important events in their life, unable to attend family gatherings. All these things can have a toll on the caregiver. As well as the financial aspect. Even though dialysis is covered by the government in Trinidad and Tobago, they still need to have transportation to their dialysis sessions. So something as easy as having a couple dollars to reach to a center for dialysis can present a big financial constraint on the family. Yeah.
Well, thank you. And maybe this question you probably should be asking us, but I'm going to still ask you. How can the church and by extension the community and family support people who are going through dialysis and chronic illness on a whole, especially kidney failure?
Okay. So one thing I like about the church, especially our church, is that they have a lot of groups, right? A lot of intercession, a lot of motivational groups there. So I think maybe these groups, could come together to help certain persons in our congregation suffering from any form of illness, not just kidney disease, that they could lend some support, whether just their physical presence there, or if it's just to have a small contribution towards the ongoing care and ongoing needs of these patients. So you can support in any way, financially, non-financially, just even saying a daily prayer for them, will add a lot to their spirits, bring up their emotion.
Yes, so we do what we can do as a church and as a community and families to uplift those who are going through chronic diseases, especially as we are referring to today, kidney failure. And we just want to thank you for joining with us today. We will continue this discussion with Dr. Mahadeo. We want to thank you for joining with us today. We will engage you again to discuss a little bit more about dialysis and the treatment options that are available, but more importantly, I would suggest prevention and nutrition and how people can protect their kidneys before it is too late. Again, Dr. Mahadeo, thank you very much.
Thanks for having me.